For a patient that needs a lumpectomy, it's an outpatient procedure, meaning that they're going to come in and go home the same day. The procedure may or may not involve radiology. They may need a wire placed prior to the procedure or a seed if the lesion is not able to be felt. A lumpectomy is typically about an hour, depending on the type of procedure that the patient needs. Really all that you remember from the surgery is just going to sleep after the IV goes in. As the breast surgeon, I then make a cut in the breast and remove the cancer, and then I will do certain plastic surgery techniques to rearrange the tissue just in that area to make it look nice. A lot of the time the stitches are underneath the skin and I use a skin glue, and that's also taken from plastic surgery techniques for the best possible appearance of the scar. I also place the scars most of the time by the areola or maybe at the bottom of the breast so that patients can wear V-necks or bathing suits and they really cannot see the scar after some time. Typically patients are at the outpatient surgery center for about 4 hours that day, but they might stay longer if they're not feeling well or if they're nauseated or if their pain is not controlled. It's abnormal to have a lot of pain after a lumpectomy, and I often compare the pain similar to the biopsy that they've had prior to the lumpectomy. The most common complications specific to a lumpectomy are things like bleeding and infection. And bleeding is very carefully monitored for throughout the procedure, but again, also in the recovery room. The other thing to be concerned about is an infection. An infection can occur in patients. It's usually less than 1% of the time. But things to look for are redness and any sort of drainage from the incision, and my patients all receive a copy of what to look for in a written form so that they can call the office and be seen immediately.